Good morning, everybody, and it's my pleasure to be part of the panel today to discuss a very important career, emerging career track for hospitality programs. Um, so I'm going to get started with sharing the screen. So my name is AJ Singh. I'm the founding director of the Hospitality and Tourism Management Program, which is a new program at the University of Texas, Rio Grande Valley. And one of the benefits of being part of a new program is that it allows you to explore curriculum offerings based on new career opportunities. And so today, along with my academic colleague, Dr. Fred D'Amico of Northern Arizona University, and two industry practitioners, Dr. Adel Eldon of Prontocare and Dr. Armor Force of DHR Health, what we plan to do is to discuss this exciting opportunity for hospitality students and also share with you a new project that we're experimenting in this area at UTRGV. So I'd like to start off by talking a little bit about the healthcare sector, which is a huge sector with annual expenditures of over $4 trillion. And as you can see from this slide, I mean, the healthcare sector encompasses a wide variety of different businesses, whether it's hospitals or medical campuses, clinics, retirement communities, nursing homes, life care, continuing care, and medical tourism. And so in typical hospitality programs, we tend to focus on basically three areas, whether it's the lodging area or hotels, or the food and beverage area, which is restaurants and others, and event and destination concentrations. But the question is there an opportunity to look at another area? One of the things that all of these areas have in common is service. And so possibly there is an opportunity for hospitality programs to look at another area. And the area that we want to talk about today is healthcare hospitality as a potential career track. So while during the discussion, Dr. Eldon and Dr. D'Amico will talk a lot about the nexus between hospitality and healthcare, I want to just throw one thing out there as a possible common ground, and that's the area of service delivery. And so if you look at the next couple of slides, the American Customer Satisfaction Index tracks customer satisfaction across 32 sectors in the United States. And one of the areas that it tracks is healthcare. And as you can see, the healthcare scores for hospitals in the US is 72. So this is a scoring system that they use. It's not very low, but it's not that high as well. If you look at it, 72 out of 100. And if you look at the next slide, which is really the hotel sector, and they track a variety of different hotels, hotels in general do a lot better. And so the question is there something that the healthcare sector can learn from the hospitality sector? So that's going to be sort of the theme of our discussion. And then leading to that, obviously, to see what are some of the emerging career choices, career tracks that our students can have. So with that, I'm going to turn it over to Dr. D'Amico to now take it away and delve a little bit more into this area that's coined as healthcare hospitality.
Thank you so much, AJ. That was a wonderful introduction. And good morning, everybody. So nice to be with you again today. So I'm going to talk about hospitality to healthcare. And I've termed this H2H, hospitality bridging healthcare. I have a healthcare background and a hospitality background. I worked at Massachusetts General Hospital in Boston, and I also have worked for Aramark and Disney and others. So I have the hospitality and healthcare. And, when thinking about our graduates, our students and future graduates, many of them aspire to be a general manager of a hotel or of a restaurant. And I see the skill set very, very similar. So I'm going to paint a picture of that and why I see these similarities between hospitality and healthcare. And as you know, healthcare is one of the fastest growing career paths for students. And I really feel that our graduates can manage large medical campuses. Some may have hotels, many more are thinking about hotels, and you'll hear a great example down in Texas a little bit later. But many of our graduates may start out in hotels or restaurants, but they gravitate towards healthcare because they can be in charge of a multi-million, billion-dollar medical campus and play a very extraordinary role, indispensable role in that operation. So if you go to the next slide, so here I kind of sum this up, that Venn diagram. So if you look at healthcare and hospitality and the nexus of the two, the intersection, you could see the similarities. And I think the next slide is a good example of this. So this was a paper that we did recently with Dr. David Miles, my colleague, and you can find it on Hospitality Net if you Google D'Amico Miles, and basically comparing the similarities of a healthcare facility with a hospitality or lodging. And you could see that we have many of the same services. So in a hotel, you might be in charge of housekeeping. In a healthcare facility, it's called environmental services in most cases. Of course, dining is the most natural, very important, and nutrition continues to play even more of a role in health. So you can see these similarities, even things like buildings and grounds, transportation, technology. The hospitality leaders in these healthcare facilities really are crucial. They're a very prominent member of the team, the medical team. And I think our graduates really have the skill set. They just need the experience of working in a healthcare facility. So as I said, I've seen firsthand, I've worked in hospitals and I've worked in hotels, and I see the overlap. So this is a great career path. If you can go to the next one. Thanks. So here's one of my favorite examples, and this appeared in Hospitality Net within this year. And basically, one of our graduates from Penn State and also from the University of Delaware left Ritz-Carlton. His name is John Timmerman, Dr. Timmerman, and he was in charge of all the quality for Ritz-Carlton hotels globally. And now he is a vice president on the medical campus at Mercy Hospital in St. Louis. It's a multi-billion-dollar operation. So if you want to read about someone that's made a very successful transition from hotels to healthcare, this is a great read. It's not very long, but I think your students would see the opportunities. And I talked to him recently, and he says his job, they've asked him to recreate healthcare, you know, for the 21st century. So he's working on that. A very good paper, I think. If you go to the next one. Also, we've written a book that looks more at this. It looks at the Mayo Clinic, and it's a great chapter on the Mayo Clinic. Top in healthcare, but they were not at where they wanted to be in hospitality services. So this chapter talks about how they really invested in hospitality to match their world-class medical and healthcare. Next slide, please. This is another paper that we did. Again, we write a lot about hotels to hospitals or H2H. And if you just Google H2H and hospitality, you'll see about 10 articles we've written in the last year if you want to learn more about it. Certainly more than I can talk about today. Next slide. Also, we've written about if Disney was to run your medical tourism business or medical center. We have several writings on the International Medical Travel Journal that talks about this H2H combination. Next slide. This is a recent one that I think also has a lot of value. And this is the one you're going to hear about shortly from Dr. Eldin, because he has a concept called Prontocare. And Prontocare is a clinic, almost like a franchise, where resorts and hotels can bring in a Prontocare and have medical right on site of the resort. And there are many competitive advantages, especially as our population is aging. People have certain conditions. Maybe they're nervous about traveling. But knowing that this resort or hotel has a Prontocare or a medical clinic within the resort is going to give people a competitive advantage. Next slide, please. This is the last slide I have. And you see the website, it's called globemed.education. We have to give Dr. Tim Muhitan a lot of credit for helping us build this. But here is where we put most of our papers. And it's a good one-stop shopping, so to speak, if you want to read some of the articles that we've written and talked about and give your students our perspective. It's free. And we also have a separate place now on the website on COVID and handling COVID situations in your hotel or hospital. So that's my last slide. I'll come back more later and answer any questions about career tracks. We have several other stories we can tell. So I'm going to pass the baton to Dr. Eldon, who's going to talk to you about his very innovative projects. Dr. Eldon?
Thank you so much, Fred. Appreciate this, Dr. D'Amico, and the opportunity to share this work that we have been doing together for many years now. And with the faculty, thank you, Dr. Singh, and thank you, Dr. Forsay. And thank you, Dr. Tim, for helping us out. So to make a very a new approach as healthcare is moving and from what it just used to be hospital into more or less into outpatient ambulatory with emphasis on disease prevention and wellness. And we'll get to that as a very compelling evidence arise. Next slide, please. So this is just a background. I was involved in healthcare on and off for the last, almost 4 decades. And we just bring in some new forms and ways to deliver healthcare in a very efficient, transparent, and affordable way. Next, please. So now we have gone through the slides that Dr. D'Amico have shown about this extreme similarity between the hospitals and hospitality, and in healthcare. It's really about serving the consumer. The COVID-19 pandemic has came and accelerated this concept, and also put a lot of other new ways that now, for instance, the hotels as being a place for people to live, even on a temporary basis, rather than traditional rentals, because of this increased needs and economic downside that came along with COVID. And the COVID, on the other side, it hit hotels, and the business and the travel and the consumer and so on. So there's a lot of downside to the business of the hotels, up to 60 to 70% occupancy went down. So now, what is the other innovative way that we could make everybody benefit, the consumer, the traveler, the hotel, and then also providing a world-class healthcare? The critical role of testing here is the really on-site Prontocare. And I want to tell people that, as a cardiologist and a doctor have been involved in this, we have over 10-year model that would, I believe, that is ready to really take up on and be everywhere to serve the growing needs of the consumer. It's really going to bring efficiency, going to bring efficiency, and it's going to bring to help people not only in the healthcare, but to clear them to get on the plane, to help to reduce this flight cancellation, and to get people onto where they need to go safely and in a positive way that will assure people, so there's no panic and there's no added anxiety to the pandemic already created. Next, please. So the benefits of a medical on-site, clinic located within the resort will serve on multiple purposes and will really help people and the hotel We have aging population. We have those who have surplus in terms of the people who can afford to travel and so on and so forth. So those have increased medical needs. Then comes in COVID with testing as well as proper triage. What to do with the patients. And then also hotels could be a place for quarantine for low risk cases, just somebody's absolutely asymptomatic with nothing except just tested positive. And now they're going to need to self-quarantine and so on. Now, with the increasing variants, as everybody's now is being kept up, it's not just COVID-19, but we have 7 variants that may lead longer a quarantine up to 2 weeks, not just a 1 week according to CDC and the classic COVID-19. So there is a lot of opportunity as we trying to maneuver our way through the pandemic and the variants, and also deliver a excellent quality healthcare and assure people and given that extra confidence that their needs, concerns will be answered right then and there on a pronto basis. There are numerous ways that we need the clinic, and they can use this in the regular need, pre-COVID world need, just for the regular day-to-day health need, but also added the COVID specific needs. Next slide, please. So the medical clinic located on site property, close proximity to hotel. I mean, it could be fitted into what they have as far as wellness or a spa on site, and it has a small kind of facility that will address all these needs. With a lot of people travel chronic conditions and have all kinds of needs that will definitely come that will help to alleviate the concern while people are traveling. Next, please. So a medical clinic on site could seamlessly tie into the current healthcare spa and the wellness, like we mentioned, and will be a great business and a great competitive advantage to the hotel. If I'm a consumer, I'm a client, I'm traveling, and I have elderly or chronic disease or whatever the situation is, and I need to have at least check with at least evaluation and triage, and I'll go over explanation with you from the medical standpoint of view, then hey, I'm gonna go where that amenity is available, so that I can have a peace of mind, and at least I know if I need something, it'll be addressed right then and there. Next slide, please. So now it will be a great feature in the on-site hotel clinics that will attract a wide demographics of guests. We have the in a world where the guests have a tourism with the post-COVID-19, and even right now, and I think they'll be looking for trust and assurance factors. And that will be also a special feature that will add to the people assurance as well as safety. Next, please. Of course, this will be a plus, and it will be a real attraction for the hotels to attract consumers if they have on-site hotel clinics to Prontocare to address those concerns. So what are we doing? We're doing the classic needs: common cold, ear infection, allergic reaction, testing for COVID, because it's a safety issue now where to put them and all that. And then we'll help also triage patients. If this patient need to be, have additional care. This patient had to be treated in accelerated fashion or not. It all has to be within. So that will help a lot of people going through duplicating the same thing in a more, I would say, risky situation when people don't feel comfortable going to the ER in the hospital, because now with the COVID pandemic, they with the other flu and other infections, they actually afraid to pick up an infection, just going to check on their status. And we'll also educate people so that they will have educational material in a very cost-effective, transparent, and efficient manner. Next, please. So I think we kind of alluded to that many times. You talk about the personal care on site, because it's all to do with customer service. If the customer is happy, they'll come again. They'll bring their family. They'll have the trust factor built into the location, and eliminate the added stress with typical hospitals and ER. The healthcare amenity is very, very important, not only for for COVID, but for everything else that's related within the healthcare needs and concerns for the travelers. Next, please. I believe now that people are looking into this, and they already are doing it in the Bahamas and other places that are reported in the literature. But I believe now people would need a dedicated on-site clinic space that could address all these concerns and provide all these services, and that will be strategic alliance with the travel industry, so that will help streamlining people get to be safe to get on a plane. People will go on, and the normal cycle of taking care of business and people's needs will be resumed in a safe environment. Next, please. And that's what really Prontocare will come in and play a critical role in providing people with quality services. So it is going to be a multi-link between the traveler. When they come to the hotel will be synchronizing for instance, the testing results with the travel agency to let people who get cleared to get on a plane or to go on, and it will be a great service for everyone, and that could be for anywhere in the globe, not just in the United States. Next, please. So the vaccine, I want people to get rid of, the vaccine is not a guarantee for not getting infected with coronavirus. Now we have also other mutants and so on. This thing will be lingering for a while, and we have to be ahead of the game in a post-COVID world, and how to adjust and be ahead of the game in terms of providing safety, efficacy, and great care to travelers and to the people to the clients of the hotel. And I believe this will be a great replacement for what it used to be, just a hospital, into really a place where people can get very conveniently, very assuringly. They don't have to travel, they don't have to drive, they don't have to have all these added service and stress and cost and so on. I believe this will definitely would be the way to go for many years to come. Next, please. So I have a proposed diagram for if we have between 1,000 and 1,200 square feet, and then hopefully could be a model that could be available, franchise, everywhere where there's a hotel we can have strategically to have Prontocare clinic on site, where people can have this in either on the first floor of the hotel, near but not exactly close to the lobby area, but at least the visible area, and it could be retrofitted into a wellness spa, and you go through a reception area where people going to be triaged and evaluated, and then we're going to go through the testing area as we go with the arrows. So they'll have vital signs, including pulse oximetry, because oxygen saturation is an important part of how to evaluate patients' degree of sickness, and they need supplemental oxygen or not. And also they're going to be testing of those who need to be cleared for travel, or be just want to have a worry taken away if they want to know if they're positive or negative, especially when it comes in contact with someone who's been tested positive for coronavirus. And then I put the EKG. I'm a cardiologist, I'm a heart doctor, so I know 1/3 of patients with coronavirus gets somehow, some way involvement of the heart. So the EKGs by either cardiac arrhythmias or something else that needs to be at least screened for that, if they're tested or there's something else that will trigger that. And then we'll have to go, if there's somebody need to go to full examination, then we'll have on either side, away from each other, and it will be properly spaced for social distancing and so on, to exam 1 and exam 2, and you have on both sides a separate exit, so nobody can get cross-contaminated or go back. It's a one-way traffic that will address patients in the best, safest, most economic way. Next, please. So there are some areas that what I believe that people would look at Prontocare as very attractive. Prontocare does protect your patient's data or client's data or travelers' data, which is different from insurance company, for instance, that have been having multi-million people data breached, and that becoming a source where the patients get their information initially encrypted and then decrypted, so they'll be sold on black market and so on. But in Prontocare, you, the consumer, own the data, and then you could share it with whoever you authorize to be done. Next, please. So again, what much does it cost? We have such variety, and it goes from one C-section can cost you from $6,000 to $60,000, and this huge variety, because it's going to end up ultimately to what people can afford. If if people can afford it and it's good and it's transparent, it's price transparency, then I'll go with you, because I believe this is a trust building kind of a feature that Prontocare put. And honesty is as important, and this is becoming a more critical in with economy of COVID and so on and so forth. So we're very sensitive to people's needs and also people's expectations. Next, please. Just to really hone in on this especially point, there is an article that just charging patients more than $10 on medication can lead to more death. $10 can make a difference between life and death. A lot of people did not really realize that, but it is very important, because if the patient cannot afford it, they'll let go, they will ignore it, they will not buy their medicine, whether it's high blood pressure, whether it's heart medicine disease, whether it's so on, and then because of that, they end up dying. This is our real data that I want to know, because Prontocare is very sensitive about that. So we put incredibly very low cost packages that's unmatched and unrivaled. And we want to at least present that to make people aware of it, about a different option on the menu for those who'd like to choose Prontocare to be on site clinics and serve people. Next, please. Okay, so I'm going to stop here, and I think if there's any question, will be towards with the panel towards the end. Thank you so much for your attention.
Great. Well, that was a fascinating presentation, Dr. Eldon, and I think between you and Dr. D'Amico, I think you made a very strong case for this emerging career track, with all the examples that Dr. D'Amico gave, with folks who are moving from the hotel industry, into the hospitality sector, the link with medical tourism, the Disney model, and then yours, Dr. Eldon, this very, very specific business model where you've shown very clearly there's this great opportunity for hotels, and particularly resorts, to link with what you're offering. So that sort of leads us, I guess, to we're doing really good on time. We're about 30 minutes into the presentation. We've got another 20 minutes, so I think we can kind of get a little bit more into some more specific things related to what does this mean for the hospitality schools and for the faculty and the programs. Is this something that we really can kind of tap in and have programs that really can build on this common ground? So what we're doing here at UTRGV, I'll have to put the blame on Dr. D'Amico. He's the one who sort of planted the seed. Before I got down here to UTRGV, he was hired as a consultant by UTRGV and DHR to kind of explore this opportunity to create a campus hotel and hospitality program at the DHR facility. So this picture over here you see is actually the Doctors Hospital at Renaissance, which is here in Edinburgh, in the Rio Grande Valley. And what we're proposing to do is actually to have a hotel, a hospitality school, and somehow link with the Doctors Hospital. And so we've actually created a concentration in healthcare hospitality. Again, I guess the seed was planted by Dr. D'Amico. So we're very early stages, which is why this panel is so meaningful for me, and hopefully some of the others who are listening, who are looking to go into this area to see, is this indeed an area that programs can benefit from? So with this, I'm going to go to the next slide and then turn it over to Dr. Forsay, because he and I have been working closely on this project, and he can share a little bit about DHR and some of the things he's envisioning to see with this partnership. So this just quickly shows you the site. The previous slide kind of gave you the whole campus, but this is basically where the hotel, the hospitality school building is going to be, and really DHR is all of this here. So we're going to be right in the middle of this doctor's hospital, and the UTRGV's College of Medicine is also going to be located at this site. So again, very early stages. It's an emerging project, but we're excited about it. And hopefully after today's panel discussion, we'll be able to get some more specifics on what we might be able to do. So with that, I'll turn it over to Dr. Forsay. He can talk a little bit about DHR Health and some of the things that he and I have been chatting about related to the program. So Dr. Forsay.
Thanks, AJ. And it is really, I think, a very exciting time. I think the two industries are coming together, and I think the COVID-19 just helps to emphasize the opportunity that we have. So we're a fairly large organization, one of the larger employees in the Valley. We now have close to 6,000 people taking care of, as you can see, 1.3 million people that came through our institution. So healthcare in large hospitals, this is one of the ongoing realities, is we have to take care of a lot of people, a lot of volume. It's part of the industry. We had to take care of the COVID patients. We actually opened a couple of COVID units specifically for them. And we got our report card back from the patients, and they weren't very good. And they kind of, what do you mean? You took care of those patients, you healed them. Why did they give you a poor report card? Well, we now have a rating system, and I'll read off some of the questions that they get to answer for you when they do the ratings. And these ratings now almost count for 25% of the total rating of your hospital. How clean was the hospital? Cleanliness. How quiet was the hospital? How responsive was the hospital to you? How well did the doctors communicate with you? How well did the nurses communicate with you? What was your overall care like? And how would you rate the hospital? So here they are, people who had a disease, some cases sick enough to be very concerned that they might die from it. We save their lives and we get a poor report card. It is the reality that the experience now is a very important part of person or client going through our institutions. And we had started to see this evolve, and the COVID story really helps to bring it out. We now have courses that we are giving to the doctors. And as was pointed out, we now have medical students in residence on our campus. So we have a fair number of learners in the healthcare profession. We have nurses from the nursing school here too. And we talk about courses on empathy. We now have courses on compassion. The difference between empathy is understanding that you might not do well or have feelings about not feeling good. Compassion, you actually do something about it. And what we've also started to do is have courses on communication, because one of the common problems we had through this was the issue about how we communicate with our clients or patients. It's a striking change in how we are seeing these patients in the hospital. And to that end, what we've done, and a number of hospitals now have done this, is we now have what's called an experience office, a person who is a chief experience officer. And that person's responsibility is to go around the hospital getting data and information about how the patients are feeling, how they are experiencing their time in the hospital, and then much to the change for the difference between empathy and compassion, they are then actually working with the healthcare teams and designing things to make the experience better, even to the point of educating specific doctors and nurses on the spot about how things that they might be doing differently to make it a better experience. So one of the things that we've done here, which is quite novel out there in the COVID world, usually when somebody comes in, they are isolated because they have COVID disease and they can't be near their family. As we learned how disruptive that is to families, we now actually have what we call a compassion visitation program, where we will actually bring somebody in, dress them up completely in protective equipment and gear, teach them how to use that, and bring them in. Somebody who is a family member who does not have COVID now can come into the COVID units to spend some time with a COVID patient, because that was so critical and such an important part of the experience that we learned about from this disease. So we are learning that this is all extremely important for our industry, for our business, and are actually putting resources to that. And so I think that this is the opportunity that A&J and I are kind of saying, all right, how can we now look to the experience that the hospitality world has and bring them in? Should they not be part of our experience office? Should they not be part of that experience team and going around and helping to teach us and train us on how to do a better job? The same exchange will go the other way, because I think, that we can do things for the hotel. And I think some of that has already been alluded to. There's actually a company now that's going around. I think it's called Well Company. It certifies that your facility is a healthy facility. So there's movement in that direction. But more specifically, and I think we heard a little bit about this concept with the clinic being in the hotel. I want to take it a little further than that. I actually think we need to go into the hotel. I think that the rooms and facilities in the hotel have to be designed to help patients who will be using those facilities. For example, how do you adjust for somebody who is obese? What about the person that's 500 pounds? How does the facility handle somebody like that? How about somebody who's deaf? How about somebody who has an amputation? These all are people that will come into the hotel settings. And as to that point, what about somebody who might need to have an occasional checkup? Should we have the situation where a nurse might come to the hotel room at 9 o'clock before you go to bed and check out and make sure that you're okay? Should they perhaps even check and make sure you took your medications? This type of integration of that healthcare concept with the hotel industry. I think it was pointed out, and this is really an important evolution in the healthcare business, is that we want to keep people out of the hospital. You pointed that out in your talk about, the clinic and how that can work. And I think it's extremely important. I don't have perfect numbers on it, but there's roughly a cost of one day in the hospital is like about $750, right? Boy, can I get a pretty good hotel room for $750 usually. So, if you think about this in the economics, the reality is the reality, right? So that we want people to come into the hospital and use the hospital when they need it, but when they need to get out, we need them out. But they may not want to be going home. They may want to be near the hospital, do the follow-up visits. Some of it does go into medical tourism. There's a great opportunity there. But even the standard person who might have a follow-up appointment in 1 week, might have a few checkups along the way in that week, they're not going to want to go home. They want to stay local. And that's where, we think this hotel that's with the hospital will be very effective. We've talked a bit about people coming and getting workups and investigations. Get off a little bit, but somebody who has to have a bowel prep and cardiac prep and all these preparations for their visit to the hospital, is the hotel really set up for convenience around that? What if you need a special commode? What if you're having some difficulties with that? Could the hotel be adjusted to make all of that very comfortable? And my thought is, and I think it's already been happening elsewhere, is the answer is yes, yes, and yes. We could really do a great job with that. And that clearly could be one of the delivery points for our combination of hotel and hospital, and a great, I think, PR or advertising for the hospital system, but certainly also for the hotel. So I don't want to take too much more time after setting the stage here, but you can see where AJ and I are trying to go. The relationship, one in which we want to bring some of the hospitality into the hospital setting, where we are acutely seeing these changes and requirements of us. And by the same time, we want to come into the hotel and help to address some of the issues within the hotel to make it so it's very comfortable for our clients in the hotel. AJ, I'll turn it back over to you for any comments.
Well, that's great, Dr. Forse. Thank you so much for your insights. And I think combined with what Dr. DeMico had brought up and Dr. Eldon brought up, I think we've certainly made a strong, compelling case that this is definitely an emerging sector. There's definitely a lot of common ground, both bi-directional. And so now the question really is for emerging programs like ours, and I'm sure others within the CHRIE system, as to, is there a market for this? And, what types of courses do we need? And so we have about, I think, 10 or 12 minutes, and hopefully with your expertise, maybe we can start to sort of at least look at some of those questions to see where the reality is, at what stage of the journey are we in terms of this thing being either a concentration or at some point even being a full major. So with that, I guess the next slide I had was really, what types of knowledge, skills, and abilities, what type of classes would actually prepare students for a career in healthcare hospitality. Some of these, I think we brought up. You said you're offering things in communication, and compassion, empathy, the service delivery aspect. I think those are fairly straightforward, but other types of classes that are sort of common ground between the two sectors. And I guess it's open for anybody's comments.
I think Dr. Eldon, he's got his hand up. Go ahead.
Yes, thank you so much. I really appreciate your presentation, Dr. Forse. And I want to add critical point. I didn't want to overwhelm with data, but Prontocare, part of the critical discussion we had with Dr. DeMico about the strategic value of having this on-site clinic is to do everything you just mentioned. As far as, everybody will come for whatever service that they need. They will check for the obesity so that you'll have specific rooms for that, the deaf, the amputees, and the checkup, the people can come in, whether it could be arranged as needed nurse to come in and maybe do a dressing wound, to check on the blood sugar, to do all that. That's all built in the Prontocare structure, and it could be a great link where people can have the rehab done on site in the hotel that could be arranged in coordination. And I had the other hubs called Florida Medical Tourism that could be synchronized with that as well for those who travel for medical tourism, because they're going to probably stay in the hotel for 5-6 days post-operatively after the surgery for the hip or knee, for ambulation and so on. So I believe it's going to fit in very, very, very nicely with everything that we mentioned in the various categories. It's going to end up to need and deliver a service that along the so many that we discussed.
Well, I'm going to build off that a little bit. We're both saying fundamentally the same thing. We're agreeing in the direction to go. But I think that the staff of the hotel, I agree that you might have a clinic area where a little higher end work is done to take care of a client. But I really think that the staff of the hotel needs to be equipped with knowledge that allows them, for example, if they see a patient or a client in the hallway who is obese or with an amputation, that they are comfortable addressing that person and helping them, whether they're the cleaning staff or from food delivery or whatever. It's going to be important for them to be very comfortable understanding what's unique about that particular client. So I think some of the coursework that we're going to need to do is to get those that level of comfort, just the same as what we have to do for the hospital staff. Whereas I'm taking care of you and I save you from your heart attack, but now I need to actually take the extra time to show you that I'm empathetic and I really care about you, and talk to you a little bit about your family. Again, extra education is required in training on both sides. Our side for particular communication, empathy, etc. On the hotel side, I'm comfortable with the diabetic. I'm comfortable that I might catch a diabetic having a hypoglycemic episode. I'll know what I can do. I don't have to be the doctor to take care of it, but I could identify it. Could I identify somebody that's having a stroke? Simple little things. You and I know there's some little algorithms that people can be trained about so they can identify those things. And the more of that happens with the staff in the hotel, the more comfortable they are, the more comfortable the clients are. So I agree with the concept of having the clinic in a focus area, but I think we're really going to have to look at education to a higher level on both sides to accomplish what we're talking about. I don't know what AJ or Fred, your thoughts?
Yeah, I think I agree with all of you. I was just like I said, this is a new area for me, but I'd been doing some reading on some of the common ground and some of the articles that show the types of things that are common between the two sectors. We talked about the customer, we talked about the service aspect, attention to detail. That's very important on both sectors. Being very good at multitasking. I think those are skills that are important. Being a team-focused player. I think, managers in both as a hospital administrator or even as a hotel manager, they need to be team-focused. The whole aspect of human relations, because you're dealing with customers, you're dealing with employees, so just a human interaction, crisis management. We saw that just recently with the pandemic here. Same issues you have in hotels, same issues you have in hospitals. So, being managing crisis, resolving conflicts, and having the strong work ethic, just like hotels, hospitals also 24/7 work environment. So there's a lot of, I think, common features. The other thing I was reading about was, where do the current healthcare administrators come from? What kind of background do they look for? And so far, some of the articles I've read show a lot of things that are common between what a top CEO of a hospitality enterprise does and what they do in hospitals. But interestingly, I was looking at, what are some of the academic credentials that these CEOs are getting. And basically a lot of them are coming with either a master in healthcare administration, or an MBA. Haven't seen anything so far that shows there's a hospitality component to this healthcare administration. So maybe there is, and that's where maybe there's an opportunity. And Fred?
Yeah, I just want to build on that. There are some universities that have the MBA have a healthcare focus in the MBA. We're developing one, H2H, as a track.
Excellent.
So very good points. And I agree with Dr. Forsay in terms of you really need a holistic approach. And the hospitality employees have to be very sensitive, be part of the team, the healthcare team, and be able to provide great service. So very important. And remember, not all hotels are going to be on a beautiful medical campus like Renaissance. So the Prontocare might be not on a medical campus and far away. So there are different opportunities for different products and services that we've talked about. The other thing I wanted to mention in my Venn diagram I showed at the beginning is about 75% of hospital services are hospitality related. So 75%. So the patient would come into the hospital, you have a procedure, operation, and then it's the care, the dining, the transportation, the entertainment, all the things that communication that are hospitality related. In fact, I like to use the term patient guest, the patient guest rather than just patient. So start thinking like Disney, everybody's a guest, right? And that's also part of the philosophy and part of the training that we have to understand. The other thing I remember from Dr. Eldon, and I think this is a great saying, we're trying to put the heart back in hospitals or healthcare, putting hospitality back in healthcare. And I think that kind of summarizes what we've talked about. There are a lot of great questions on the chat. AJ, if I can just address some of those.
Sure.
One of them is, how do hospitality professors, faculty learn about this new field? So there are some resources. The website I showed you, the globemed.education. I teach a course in spa and well-being management here at Northern Arizona University. So I brought in this H2H into it. The spa is a sexy name. Students are attracted to it. So I was able to bring in more healthcare and medical professionals into my class So tie it into the well-being. So some of you have courses like this. It's a good way to start, but it is a challenge. There was another question to get students excited about healthcare. They just don't really understand the opportunities that a hospitality graduate can have a very leading role on a medical campus and make good income, 6 figures. And they're managing multi-million or billion-dollar operations. And we give them the accounting, the finance, the marketing, human resources. And I think it's a matter of getting it into your intro class, which many of you do, and also maybe have an elective class. But also very important is we're working with Aramark and Sodexo. They come to campus every semester recruiting. They run healthcare facilities. So get them in your classes. And then the last thing I'll say, get the student an internship, maybe with an Aramark in their health services division or Renaissance. I'm sure their dining department would love to hire your students in the summer. So it is, we're discovering this, right? It's kind of relatively new, but it's a great career track. And let me just say, during the Great Recession we came out of, right? What kept growing? Healthcare. It was like the only industry that was hiring. Hospitality, hotels weren't hiring. Restaurants weren't necessarily hiring, but healthcare. So it's a very long-term and viable career where you can use your hospitality skill set to work with the people in the hospital to provide a real service and great value to the medical center.
Somebody was asking the question: are there other disciplines involved? And there are multiple disciplines in healthcare that can tie into this. As you heard, there's the rehabilitation, physiotherapy, social services, all of these additional services that are linked to healthcare that are all very much needing to be tied into the hospitality and the concept of what we do with regard to taking care of, I like your term, the guest. One of the other features of that, just for an example, is the fact that we've learned that some of the arrangements that we have to make after the hospital work out very well in the hotel, but after that, they may have to be arrangements at the house. And so another extension of us is to go to the homes and actually interact with the people in their houses. Again, if you don't really do the appropriate way of approaching a household and dealing with a family, it becomes a problem. So that's going to be a whole other area, again, where there's the whole idea of communication and interactions are going to be really important and spin right off of the concept of hospitality.
All right, that is
any other
fantastic.
questions in the chat that we haven't answered? Because I can't see the chat since I've got the screen up.
I think somebody talked about elderly people. I think we've commented about that. More and more older folks in our population need attention. And we need to make sure that we are able to address those issues, both in the hospital setting and in the hotel setting. They need specific ways of handling them. I don't see any more of the chat.
Dr. Eldon, you had a comment you were going to make?
Yes, I'm going to say this to sum it up. Prontocare could be the connecting link for whatever the hospital needs with the patient, whatever the patient's need and services. We could have this through the close collaboration. The hospital needs a special room because of large size, need of handicapped access, whatever it is, the diet, the services, the rehab, in addition to what already been said. So it's going to be like a one-stop healthcare liaison, if you would, if that needed, for the regular needs that we discussed, for the COVID pandemic added needs, for the medical tourism link to the hospital-based services. So it's going to be a great asset and benefit, and also prestige to the hotel to have something like Prontocare on site to do all these services for the guest and the consumer.
Well, we certainly have a
Dr. Eldon, if I can just further sum up, because the overall theme of our presentation today is this as an emerging career track. And the hospitality schools, most hospitality schools are very industry specific. So all the curriculum is you look at the output, see where are our students going to be placed, and you design the curriculum and the courses around that. Since this is an emerging area and since Pronto is now getting into the space, do you see Pronto as potentially hiring people with a hospitality degree for these types of clinics or this business model that you have in resorts and hotels?
I believe Prontocare could play a strategic role as we have partnership with similar-minded people who think what is the best thing for the consumer or the client or the guest, as well as the upcoming staff, how to take care of this new area, new service, and how to clean it. And I went back to the MBA, by the way, in healthcare management to really add the business part into the medicine. And I believe now we have a great opportunity to let people know, if you want to come be a part of this ecosystem, absolutely, it'll be great opportunities, unlimited opportunities for both the consumer as well as those in this hospitality industry.
Thank you. Dr. Force, you had a comment?
No, I was going to quickly say there are many aspects to the caring of the client or the guest. We have food services, which we've talked about. One of the problems, I think, all across the board is actually making it food services attractive for the patient, yet healthy. So there's how to do that. I think what we just talked a little bit about is making a room comfortable for somebody. All types of things that have to be done for the large person, tall person, short person. So there's tremendous management opportunities and business opportunities to link with those industries to help work together to solve the problems. And I think that's a business skill set that's going to be required with specific knowledge about the situation that they're working in. That's unique to us.
Great.
Thank you, Doctor.
As the resident expert and person who's written so much in this area and pioneer, did you want to have the last word?
That'd be me, I guess, huh? Thank you, AJ. Yes, I think there's great chat questions. And another career opportunity would be working at active adult communities, retirement communities for our students. And now there's some great models. I'm trying to write a paper on this where communities, homes are being built around medical campuses, well-being with spas and exercise, dining, all focused on well-being. And again, that's a whole nother career track opportunity. And actually many campuses now that have medical schools are building these retirement communities for alumni. And it's a big focus on health and wellness and using the facilities of the campuses, recreation, natatoriums, pools, that sort of thing. So really, this is this H2H, I call it hospitality to health, H2H, really has so many career opportunities. It's just our job as faculty and professionals to uncover these, to share these, market these to our students. They're young. They see hotels, they see restaurants, but they may not think about the opportunities with healthcare. It's, one of the fastest growing areas, right? As an aging society, and people want to stay active, stay young, and food, hospitality, exercise, spas, well-being, all connect. Everything we teach our students. And so it's, and the last thing I'll say, it's about creating the patient guest experience. And who better than hospitality graduates to create experiences for the patient guest. So we have a great opportunity, and I look forward to working with people that have interest. I'm happy to share what I've written and help you in any way if you have an interest. So I think we're thank you, AJ, for leading this, putting it together. Thanks for the University of Texas, Rio Grande Valley. Thanks for Robert, Dr. Force, for his expertise. He's a pioneer in this as a physician, but also working with hospitality with the hotel. And Dr. Eldon, a cardiologist that has an interest in hospitality with the Prontocare. So there's a lot of nice products and services at our disposal to teach about and to build in our communities. So thank you, everybody.